Today's presentation is about the healthcare provider burnout, which is an interesting topic. Usually, we know that burnout is a psychological process that's being when a human service professionals are overwhelmed with unexpected stressful aspects of their job that frustrated their efforts to make a positive impact on others. We know that the burnout has three major dimensions, which usually we look at on the when we look at the person with a burnout problems. So it is the emotional exhaustion, the depersonalization, and the personal accomplishment. And those are the factors that play a role on that burnout status. And we know that the prevalence is well reported in the literature through our national and international data, and it is quite high. Maybe in the last two studies here, you can look at the level of burnout, which is quite moderate to high, and critical care nurses, which are an area of where the critical care is highly needed. And interestingly, even and the last study was done in 2017, even students reported also some emotional exhaustion, and those are not even yet been into the field. So what do we know? And a meta-analysis was published in looking at international data. There was a small, medium-sized relationship between burnout and both quality, decrease in quality care, and decrease in safety. So it's there, but the relationship is quite, let's say, not that much relevant. So, and the burnout components of emotional exhaustion had a strong relationship with the quality, followed by the depersonalization and reduced personal accomplishment. So although it has a good impact on the personal, a bad impact on the person itself. The findings suggested that emotional exhaustion may be the most critical element of the burnout addressed of those human were studied. So it is a matter of emotional status that we're looking at. On a regional data, the incidence is quite reported higher, where it is, you know, looking at a medium to high but wide range prevalence estimated on the burnout among health care professionals in Arab countries. And this systematic review, it reinforces that the need to reduce the occupational stressors, and that's maybe the difference between the regional and the international data, where we look at the occupational stressors by improving the workplace environment and developing a culturally relevant resilience-building programs for healthcare professionals working in Arab countries. And this is, maybe Dr. Fahad has spoken about it among spine surgeons yesterday. So how do we measure burnout? In order to measure something, you even look at the dimensions that affect this problem. Again, it's emotional exhaustions, the depersonalization, and the personal accomplishment. There is an outcome measure called MISLASH, where it looks at, it's about 50 questions, look at the different dimension of the burnout. You look at the workload, the community, the control, the rewards, and the fairness, and the values among burnout. And this is how it looked like. So it is self-reported. And that gives you quantifiable data in order for you to take that intervention if needed. So what are the consequences? The consequences of burnout could be on a personal level. It could affect the person physically, and that's even we see when you see that employee complaining of some physical symptoms, or emotionally, where the people start to disengage. Even on an organizational level, the work performance can be affected. The number of days of the employee is absent is even affected. The reduce of quality, which is well reported in the literature, as I just mentioned. Guess what? Even the turnover is increases by 150 times. So, it has even a greater impact on the organizations. So how do people cope? Usually people cope through 3 different strategies, even by, like, they go for problem-focused coping strategies. They look into emotionally focused coping strategies where they are quite emotionally involved, or just avoid. So a kind of similar to the fear avoidance kind of strategy. So we need to have that balance between the coping and the burnout, where workers who frequently use insufficient coping strategies tend to report a higher level of emotional exhaustion and deep personalization. A nice article published by Harvard Business School looking at how can we help healthcare providers to avoid burnout. 2 main important dimensions, which is activation. It's the extent which the person is motivated by his work and feeling meaningful. So here are areas where you try to engage those individuals and make them their work meaningful to them. And the more they have that emotional feedback, the more active they will be. And the decompression, it's not a spinal decompression. When they decompress is the time where they feel that they have to say no, and I need to step and enjoy other things other than work. And this is an area where us as managers, as work owners, we try to push more our staff, and we don't value the off time importance and the value of that, improving that kind of culture to our organization. What can we do about it? Organizations should direct their resource and efforts in reducing stress that makes it challenging to clinicians. Why? So there is a lot of work now, publication talking about patient experience. Guess what? People experience, employees experience is quite important, because those are your engine to reach the organizational goal and the overall goal of the healthcare kind of organizations. If you don't have that balance, it's going to be very challenging. So I wanted to share with you a few take-home messages. Today, if you are a department head, a manager, a supervisor, if you are in charge of a team, if you are a charge nurse, you need to reduce occupational stressors. What are things that makes your employee stressful? It could be not having a coffee in the morning. It could be something as simple. It could be something huge. Look at it, spend some time, always have a feedback, and then you will find those things and keep on looking for it and try to go through them and modify them as possible. Improve the workplace environment, and we had a nice kind of experience with that in a small clinic that I'm working at. You just do some sort of changes and here and there, put some sort of a coffee machine, books, quiet area that can have a good reflection on the employee's productivity. Develop culturally relevant resilience building program. It's a way that your employee has to start venting and can kind of maintain that balance that we talked about, and it is something like quite important. So thank you very much. It's quite an interesting topic. I hope that I shared with you a few highlights about it. It's a big topic, but I thought of sharing with you a few slides about it. Thank you very much.